With that, we go to our fourth respondent. So we have the European perspective, the Romanian perspective, which was not doing so well in this survey. We now go to the policy perspective and the Netherlands, so a country who scored top of this kind of ranking system. Abida, how surprised were you by this, or did you just expect the Netherlands to do so well? And what's maybe the secret of doing so well in this international European comparison?
Thank you very much, Jean, for the opportunity to speak here. I think it was good to read. I mean, or to also to see that the Netherlands is doing good in many areas, but we are still not there. As you mentioned, we are now like 70% or 75%, so we still have to do the rest too. So we have, of course, certain areas in which we are doing good. We have a national policy, I mean, the National Dementia Strategy, which we are working since 2021, and it will go till 2030. So, which also focuses on research, but on the other hand, also that people with dementia matters, also to work on stigmas, also to bring more awareness, but also to care and give support and care for the people who really need it, and also to have people living at their homes as far as they can live, with the help of healthcare providers, but also introducing new technologies which are now in place, I think, in nursing homes, but also in the home care. So there are different areas in which we are working through our national dementia strategy. But on the other hand, I think it also depends how the healthcare system in a country is being organized. For example, in the Netherlands, we have like 3 complementary laws which supports, or I can say, which helps the healthcare system to it is a kind of a universal healthcare system which is available for all the citizens of the Netherlands, so they can if they need some kind of help. For example, there are the municipalities which can help them. We have the Alzheimer Association, of course, of the Netherlands, who are working very good in many areas to support people with dementia. So we have other committed organizations who are working to find solutions for this disease. So there are different, and on the other hand, on the government, we can say on the national level, there are also some other programs introduced in 2022, which will also help the national dementia strategy to further strengthen itself, and also in different areas. For example, prevention, because looking at the aging society, that is also a thing which in many countries in Europe, but also beyond Europe, that aging society is challenging, and also the number of people who will be available for us care, the affordability and the accessibility to healthcare systems. So these are challenges I think that we have to work on it. One thing I was really very curious about this report was that there were questions, or you can say the questions that were asked about availability and the affordability. So when is it sufficient? I mean, it's a really subjective term, and according to each, or I can say the healthcare system, it may also have certain kind of contributing factor how care is affordable and how care is accessible. So if you say sufficient, okay, am I satisfied with if I say, okay, if 7 out of 10 people get the care they need, is that sufficient? Or should I say, is it sufficient if 10 out of 10 get that care?
Now, I think you touched on a very important point, and it's also the caveat with which I started the presentation, is these are the responses of national Alzheimer's organizations. So that might not be the same answer that you might have provided for some of these questions as a representative of the government, because you probably think that some of the service that you're providing, that you're supporting, would be sufficiently available, but there's no statistics that we have used for this. So it's not 7 out of 10 people that wanted to have access to these services were able to access it. It was very much more a kind of gut feeling almost from the association, but also based on the many discussions, conversations that they have with people living with the disease and carers. Sometimes that I was also surprised that certain countries in Western Europe were very critical about the availability of certain care services. Whereas if you went to a neighboring country, they would have been delighted to be able to get to the level of that country. So it is this kind of perception over national associations that we've been able to capture this, but it's definitely not hard science that we were able to do here.
On a personal note, because I'm living with mixed dementia, vascular and Alzheimer's, and also a comorbidity of emphysema. Dementia doesn't travel alone. On a personal note, I'm very pleased with the report of what's going on, everywhere, and the people that are trying. But on a sad note, I'm very sad that a group of human beings become less. That we're talking about not giving them care, not giving them friendliness, not giving them support, and not providing services. You shouldn't become less of a human being after a diagnosis.